Welcome to SMA's Southern Medicine Podcast. Practicing medicine in the southeastern United States presents unique challenges for healthcare professionals. The South's heavily rural population and limited resources require medical professionals to be more resourceful in their approach to providing quality care. SMA's Southern Medicine Podcast addresses these issues by drawing on the experience of healthcare leaders who provide a multi-specialty, interdisciplinary team approach to medicine for the purpose of providing better care for the Southern patient population. Today we are speaking with James Lowery, who is a U.S. citizen living in Cyprus. James will be sharing his perspective of being abroad during the COVID-19 pandemic. Thank you for joining us today, James.
Yeah, thanks for having me, Jennifer.
Before we start talking about the pandemic specifically, I was just wondering if you could briefly share with us what brought you to Cyprus and how long have you been there?
Yeah, that's a great question. So my wife and I moved to Cyprus, I should say, kind of moved to Cyprus. We left the U.S. in September. We saved some money, bought some rental properties, and then decided that we wanted to start traveling kind of full time. And her grandparents actually live in Cyprus. Her dad's from Cyprus, so she's a second generation immigrant. And so that kind of made it an easy place for us to use as a headquarters to travel around Europe and things like that. So that's kind of what brought us to Cyprus, and we've been in and around Cyprus since September, traveling through Europe and different places like that.
Now that you're there and you're seeing what is happening around the world with the COVID-19 pandemic, let's just kind of jump right into that. Today, we learned that the U.S. has surpassed in cases, and where it's just growing exponentially at this point. What is the case spread like in Cyprus, and is it growing or has it leveled off? I know that you have restrictions in place that we will talk about, but what are you seeing with the spread itself?
So it is still spreading. They have, like you mentioned, implemented some guidelines to try to keep that from happening, but it is still spreading currently, but it's not quite to the same rate. I think we have, if I'm not mistaken, around 180 cases, and that's currently as of like this morning, I think.
Okay, now since we sort of touched on the restrictions, tell us a little bit about kind of what those are and if you're sheltering in place and how the country is trying to keep citizens safe, healthcare workers safe, what you're experiencing with that.
Absolutely. So a little over a week and a half ago, they started closing down the schools. They closed down the schools in the capital city first, and then the next day they closed down all the schools after that. And then they released guidelines saying to close any business that's not essential. And these were, like I said, guidelines at the time, and it worked to a degree, but not as much as they had hoped, because they would still see people sitting out at coffee shops and things like that. And so about 3 days ago, they implemented the exact same thing, except now it's a law. Like, they came out and said that you cannot leave your home unless it's for, a small list of things that include groceries, going to a pharmacy, medical care, exercising or walking your dog, or assisting ailing or elderly people. And so, and even those things you have to submit to a text. You have to say exactly, like, your ID number, which I use my passport number for that. I have to put in the text what the reason is that I'm going, and so that corresponds as a number. So I usually put in number 6 because that's us exercising. So and then they can either approve or deny it, and they send that out for you get approved for about 3 hours max. And as of this morning, they had arrested or fined 500 people for going out and not doing the guidelines that they had submitted. And at the time, it was a €150 fine, which comes out to about $165. But they've submitted a request today to get that raised to $3,000 because they had so many people fined in the first couple of days that they really want to kind of make a point to get people to stay home. And we have been kind of social distancing for a few weeks now, and just limiting our contact with other people. We just go to the grocery store, and even at the grocery store, there's a limit for how many people can go in at a certain time, and that's based on the floor space. So they said that the government released these guidelines to say that you can't be in a grocery store. There can't be more than one person per 8 meters squared. So essentially, they took the floor plan of each grocery store and worked out how many people can be in each one. And there's an employee at the front that has a little checklist, and he allows people to go in at certain times, and you might have to wait until someone leaves before you can go in. And they've got hand sanitizer and gloves there for everybody to use if they'd like to use that before going in, and they actually pretty much make you use those. So that's hopefully going to hedge the growth a little bit as well.
This is absolutely fascinating. And if I could just jump back to the you text and then you get a response that you're approved or not approved. About how long does it take to get approval? If you realize you needed medicine at the pharmacy, are you waiting hours before you get approval, or is it fairly quickly that you get an answer?
That's a great question. So it varies, and that's the reason I say that is because the first night that they implemented this, they got overwhelmed with how many people were texting. All of a sudden, everybody's wanting to go and walk their dog or borrow their neighbor's dog and walk them. And so, at the beginning, the whole system was overwhelmed. But now it's within, I would say, maximum about 10 or 15 minutes. Now, the other side of that is some people may not have texting capabilities or might not have a mobile phone, some of the older generation, or if you're someone that doesn't have a local number, then you can go online and fill out a PDF form saying why you're going out. And if they catch you lying, then at that point you'll be fined even more so. And I think they might even arrest you at that point. So it would be a situation where you don't necessarily want to fudge the truth on the yeah, yeah, on the form.
Wow, that's amazing. And again, that's kind of a follow-up question to that. You said if you are caught out without having gotten approval, how do they track that? Do they ask to see your phone where you got approval, or do you have to show proof that you are allowed to be out in those places?
So
And it's
essentially something like
random.
that, they stop you. Yeah, it's kind of random. As we've been out the past couple of days, we've seen more police out than ever before, and they just stop people. So for instance, we walked to the grocery store earlier, and two passed us, but at that point we had, our reusable bags, and we're carrying with us, and we're walking the route to the grocery store, and that's kind of the only grocery store in the area. So I think that they just knew what we were doing, so they didn't bother stopping us. And yesterday we got passed by police twice while we were running, and the guideline is for exercise and for walking your dog, it has to be within the vicinity of the home, which is a very vague term. But we assume because you have to actually send what your zip code is when you submit your request, that if you're caught outside your zip code, that they'll assume that you're not in the vicinity of your home, and so then they might give you a fine. I don't think they will, but they have the ability to if they wanted to at that point.
Wow, that is very, very fascinating. And you were talking about the grocery store. Here, as I'm sure you've heard, many, actually all parts of the country are experiencing shortages of things like, of all things, toilet paper, certain milk, eggs, certain items like that, because of what they're calling panic buying. Are you seeing that in the stores in Cyprus?
Not at all. We went a couple of days ago because we thought it would be bad, and we went in, and the shelves were full. There was toilet paper. There were, all of like the staple items, milk and eggs and bread. All of these things were there. And no one had more than a couple of days worth of groceries, even as they were checking out. And we do see in the U.S., just on Facebook, social media, and friends and family telling us, that they've gone to Costco and they're waiting in line 3 hours just to, get to the front to check out or something, ridiculous like that. And so it's pretty eye opening. We're pretty lucky that it hasn't got to that point here, and I don't think it will at this point because they've already implemented the quarantine in place, and so now would be the time that you would see people buying as much as possible, and it hasn't really happened. We even went to the grocery store today, and the shelves were still full, and we just picked up a few things, and I figure we'll probably go by the middle of next week again.
how long is your quarantine in place? Or is it the 14 days, the 21 days, or have they extended it? Or have they even said they're now saying some places may have one for an indeterminate amount of time that will be monitored daily?
Yes, so ours is actually they started it 3 days ago, and they said that it was going to be until April 14th. But they've also come out and said that these guidelines are just preemptive, and that it could be extended. They said that the timeline is based on the virus, not on governmental things, and so their hope is that they can get it under control pretty quickly, and not overwhelm the medical system, and that's the reason why they're doing what they're doing, obviously. And so they're hopeful that this keeps people from getting together and spreading the disease is what I should say, not spending time together, but spreading the disease and things like that, and the virus. And so that's I know that's a key point, and so that's why they've come out and said that it's only for a certain amount of time for now, and that depends on how people adhere to the rules.
As we're talking more about the virus and the spread, as a U.S. citizen in being abroad, if you were to need to be tested or need access to care during this pandemic, do you face any unique challenges in terms of health insurance, or what kind of care you can access during this time?
That is a question that we get quite a lot. My wife is actually a Cypriot citizen here, so she has access to the entire EU. So she can go to, Spain, Portugal, France, Italy, any of the EU countries. Not that she would want to go to any of those right
I was
now,
going to say, maybe not
but
right now.
yeah, they're not the places she would want to be right now. Me, on the other hand, I have a private health insurance plan that is essentially an international plan. The only thing it doesn't cover is the U.S. And the reason being that obviously healthcare in the U.S. is pretty. I would use the word bloated personally, but and so you can select an international health plan that covers the U.S. as well, and it just essentially doubles it in price. So I pay about $300 for a year, and that's with a $2,500 deductible, which also still gives me the high deductible health plan, so I can still contribute to an HSA, which I did that purposefully because my wife and I contribute to HSA for that. But essentially, it's the exact same way that health insurance works in the U.S. Once I meet the deductible, I think I've got a $2 million cap on how much treatment I can receive. Now, with that being said, I think even here in Cyprus, they're offering the COVID-19 test for free if you have the symptoms. Now, if you don't have symptoms, you can pay to have it done privately. But if you have symptoms, then they will actually quarantine you. They've got a specific hospital that they're sending all the cases to. That way, it doesn't spread to all the other hospitals, and that way, that hospital is very attuned with how they should be treating things, and the sterilization of things, and the entry process and different things like that. And so that way they can kind of alleviate some of the other hospitals for other emergencies that still happen.
If you test positive, and I assume the way you're talking that it's offered for free, or you can do a private test, that there is not the backlog or the shortage of testing that we're seeing in parts of the US. It sounds like the testing is fairly accessible there for anyone who is
It
demonstrating symptoms.
Yeah, it is. It's I would say, yeah, that's the key part. I think that's probably a loophole that, or not a loophole, a hoop that most places are making people jump through because they don't have just a plethora of tests that they can test everybody. Some of the Asian countries I've heard are doing that, just blanket testing everybody so that they can try to hone in on who has it and kind of quarantine it early. Here, you do still have to have some symptoms, and really, it's particularly if you're one of the at-risk categories, then they pretty much bump you to the front of the line because they just want to be sure that you're getting the care that you need. Now, if you do test positive here, what they'll do is at that point they will quarantine you, and they've got a specific place that they've used a hotel in one of the villages outside any major area that they're quarantining different students that have come in once they started closing borders down and everything like that. Everybody started trying to fly back to be home, and so they used a specific hotel to quarantine those people in to try to keep them from spreading it throughout their families and then throughout the entire country essentially.
So it sounds like, so if I had the test and I tested positive, am I automatically quarantined to a certain location or the hospital, or am I allowed to go home and self isolate and quarantine within my home, or am I automatically removed from outside and I'm taken to one of these facilities?
Yeah, yeah. So it actually depends on many people here, live with family members or live with, there it's a multi-generational households here. There are a lot of those. And so it depends on if that's the situation. If it is, then they will essentially quarantine you. They'll send you to this hotel where they provide, all your meals and everything like that. And so they try to make it as easy as possible, but there is a chance, that if you don't have anybody at home, that they will let you go home and quarantine in the house. And so there are certain checks for that as well. I think that the police probably drive by your house a lot more if that's the case than they do just every other neighborhood.
In kind of talking about the healthcare, we're seeing in the U.S. that more and more physicians, as they are able, are transitioning to telemedicine to still provide care for their patients. Um, is that an option in Cyprus? Do you see telemedicine or remote medicine? Is that something that citizens can access as physicians are on the front lines fighting the pandemic?
I don't think so. I just don't think that I think they have the capability for it. I just don't think that they've explored it, and they don't really have the systems in place to do that. Yeah, now the physicians are very accessible. You can easily call them, text them, things like that. But as far as, if you come here and you don't have any ties essentially, and you just hopped online and tried to find a physician that you could do a teledoc with, or, have an appointment with via, the internet. I don't think that they actually have that capability. I think that that's something they should be exploring to try to limit this even more and keep people from going out. But they haven't been doing that yet. I know that that's a big thing right now in the States, and even, uh, I would say different types of healthcare that normally wouldn't do it, like physical therapy and things like that, or even looking into doing it in the States so that they can continue to treat people while they're quarantined.
As a US citizen, you're abroad, you have a very unique perspective of this, and this is just really kind of strictly your opinion. As you look at the US and how we're fighting COVID-19 versus what you're seeing in the EU countries, do you see a comparison? Do you see things that are different, or that we may be doing well, or things that we could take an example from where you are? I mean, the quarantining, the strict sheltering in place, are those things you think that the US might benefit from if we were to try and adopt some of those kinds of things, just kind of as a comparison?
I absolutely think that the U.S. could learn from other countries as both a way to see how to do things and how not to do things. And obviously, this varies widely. Like we had mentioned, Italy and France and Spain earlier. Italy has obviously been probably the worst hit country, even though the U.S. has the most cases right now. I know that Italy still is in. I don't want to say the lead because it's not a good thing, but they have the most amount of deaths and things like that. So that's something that they should, look at. So the entire EU, just because of how densely populated it is and things like that, it would make it very, very easy for the U.S. to look and see what has worked and what hasn't worked on a very, micro scale, that they could, separate countries and different policies and things like that to see exactly what is working and isn't working. I think that having stricter guidelines for people that have tested positive, or having testing more readily available. I think that that'll probably take a turn soon once the tests become, available as the manufacturers get more of them and things like that. I think that that will probably help the U.S. with combating COVID-19. But as of right now, I think that it's getting worse much quicker than it's going to get better, just based on the response rate and the lack of testing, and a lot of the states, even, or the states are similar to the countries in the EU where, Ohio has been shut down for weeks, but, Oklahoma is still telling people to go out and acting like it isn't happening. So it's a very different reaction to the exact same thing across the board, which is pretty interesting to me.
This has been an absolutely fascinating and eye-opening conversation for me, and I'm sure it will be for our listeners. And I cannot thank you enough for sharing your story. And before we conclude, I would just ask, do you have any kind of key observation takeaway that you would like to share with our listeners, just as a citizen experiencing this abroad, and anything you'd like our listeners to know?
I would just say, take it seriously. It's something that while you may be young and healthy, it could be, the difference between you saving or essentially costing someone's life of someone that you'll never meet. You could pass this on to someone else and then they pass it on to their grandparent or, someone that's in the at-risk categories. And, if you have any symptoms at all, and even if you don't, just trying to socially distance yourself, stay home, binge on Netflix, all of a sudden everybody wants to be outside when they've spent their last 2 years of their life inside. And so it's kind of interesting.
Before we conclude, are there any final thoughts you would like to share?
I actually think if I did add anything in, that would probably be in Cyprus. It's much like it is in the US. People are very like pro freedom, anti-government. I can do what I want. And so by implementing the guidelines at first and then coming in and saying we're going to give you a fine, I think that had they done the fine thing initially, then they would have had riots in the streets, much like it would be in the US. But because they implemented it slowly and progressively, and as it got worse, they just made another change. And as it got worse, they made another change. I think that's been a key part to getting people on board here, because even now there are people that are saying, I'll give you until the 14th, and then I'm going to be at the beach. I don't care what you say. I've given you all the time I'm going to give you. And so it's really funny.
Thank you again for joining us. To subscribe to additional SMA podcasts, please visit sma.org/podcasts.